Welcome to A Minute with Gwen. I am very honored today to be joined by a distinguished scholar, advocate, and public intellectual, Thomas Levice, who is the director of the Hopkins Center for Health Disparity Solutions. And he comes to us today at a very, very important moment in our history as we are about to see the new phase of the Affordable Care Act go into implementation. Hello, Thomas.
Hello.
Well, we're in a new phase of the Affordable Care Act, looking at implementation. What does it mean for health disparities and for health equity?
We're moving into a really key phase of implementation for the Affordable Care Act right now. Probably the most important thing about this new phase is the potential to dramatically expand the availability of health care to up to 30 million Americans who are currently without access to care. Also, if the implementation goes as planned, it should also control the rise in healthcare costs and even place controls on increasing costs for healthcare premiums.
Critics of the Affordable Care Act have really lobbed complaints on both sides of the political spectrum. On the right, they complain that Obamacare is socialized medicine, and on the left, they say that the ACA doesn't go far enough and that it's more or less a program that supports insurance providers. What are your thoughts?
I think both perspectives have some currency, but I also think it's, like most things, is nuanced. So what does socialism mean? We currently have in the United States several universal health care programs, including the VA system, which is by definition socialized, and we also have the Medicare program, which is also socialized and universal for people over age 65. That doesn't mean that it's not going to still be high quality care, and those systems, by the way, do a much better job of controlling costs than the for-profit market-based system that we currently have for most Americans who are getting insurance through their health, to their employer. Well, as far as those who say that it doesn't go far enough, well, I'd agree with that as well. It doesn't go far enough. But this is certainly a huge step towards bringing us to where we need to be in this country, of having full access to care for all Americans. If things are implemented the way they're planned, we should expand access to about 30 million more Americans who currently don't have access to care. Now, this will still leave about 20 million without access to care, but we'd have to admit this is clearly a huge step in the right direction and one that we should embrace.
Thank you so much for joining us, Dr. Levice. We look forward to seeing a lot of the work that you and the center are doing really help to advance health equity in the future.